everyone, welcome back to the Dish on Aging. This is episode 4. Today we will be talking about how family members can best support seniors who during this pandemic. Today I'm going to introduce a plan on how families can be supportive. That plan can be summarized in 4 steps. Those steps are: listen, respect, understand, support, and also I'm going to be adding on a caveat, and that is to watch the ouch. Watch the ouch is what I refer to when family members are doing a good thing. They are trying to protect the oldest members of their family from the pandemic. So that's good. What the ouch is when the younger family members will move forward with a family gathering, only to exclude the oldest members of the family. For many seniors, or for most, this can be an emotional ouch. So in my efforts to, prevent that, if I can, I want family members just to be aware of that. If it's not possible for every family member to attend a gathering within reason, does it make sense to have the gathering? I just want everybody to think about that. And that is the way to, just be aware of the ouch that is happening right now during this pandemic. Now I want to go into more detail about the listening. How to listen to anyone. By the way, this is how to be supportive of anyone, to be supportive of seniors during the pandemic, whether it's the pandemic or not the pandemic. And that is to listen to the perspective of the person talking. Most of us, unless you work as a psychologist or otherwise are in a helping profession or just a very understanding, caring person, most of us, need some support and how to help develop our listening skills. And listening is just simply to just sit and listen to what the person has to say. So that's how to listen. And the hardest part is when you're listening, you got to have lips buttoned up. That means you can't speak. You have to just listen. So for some of you, this may be a new exercise. You can practice at home, practice with friends if you wish, before you go to approach maybe grandparent, parents, say, I want to be supportive, and this Dr. Sweeney, psychologist, says I need to listen. So give that a go. Now I want to talk about how to be respectful when somebody is talking and you are listening. This is, I think, the most difficult task that I am presenting today. This pandemic, separate from the fact that it has become politicized, there is so much confusing and contradictory and inconsistent and changing information about everything about this pandemic. It can be very difficult to be respectful and not say anything, not judge, not correct, not argue when another person is talking about their perspective or experience with this pandemic. So in the same way that some of you may be developing listening skills, even more of a challenge for others of you may be developing skills on how to be respectful. That means to remain silent, not to argue. What you can do is make a mental note. If because the information is changing so quickly, if somebody is making a statement that was true 2 months ago and it's not true anymore, for example, this week, anyone who lives in the community who's age 65 or older has been opened up to be included in that first group of people to get access to the vaccinations. So if somebody says they have to wait to sign up, let's say they're 85 and they say they have to wait until they turn, they have to wait until they turn 86, which might not be till May or June before they can get a vaccination. Wait until the very, very end when they're all done speaking, telling you their experience, and say, I believe there's been a change in when seniors living in the community can receive a vaccination. And that's when you bring in the updated information. That's part of being supportive, and it's not arguing. Understand. Understand when you are listening and you're being respectful. That means you're not speaking or arguing. Understand that there is no objective of right or wrong. Everyone is going to have a different experience with this pandemic. Some may be more anxious because of their medical conditions, and that is reality based. It's not an anxiety condition. Oh, speaking of anxiety conditions, I have observed in my own work that there are some individuals of every age group who are developing an anxiety response to, or anxiety symptoms, in some cases, an anxiety diagnosis in response to the pandemic. So understand that that makes sense. For some people, that will happen. And again, listen, don't argue. And understand everyone's experience is going to be different. And part of the understanding that everyone's experience is going to be different is going to help to guide you into the fourth step of what I am introducing today. The fourth step is support, how to take action to be supportive of another person. And you've now gone through the listening. You were now respectful with the listening, meaning you weren't arguing or correcting. And you understand now that the experience of the person you're talking to may be very different than your own experience. So you're putting your own reaction, your own experience on the back burner. And when you're in support mode, you now have information that allows you to move forward in a constructive way to be able to be supportive of the person. I think across this country, not just here in the Philadelphia region where many of us live, across the country, I think the single most important way that family members are going to be able to be supportive of seniors is to help or guide them through getting their names on a list for vaccination, if they're comfortable with that. Keep in mind, for some people, because of their medical diagnosis, their doctors may be saying to them, I don't want you to get a vaccination just yet. The vast majority of medical doctors, primary care physicians, are going to be telling seniors, I would actually like you to be first in line to get one. But there will be some individuals who their doctors will say, let's just hold off a few months and see how this goes because of your specific medical situation. But separate from that, many, not all, seniors are going to need help navigating the internet to sign up online to get your name on a list. And also, I did this myself this week here in Bucks County, interacting with the Bucks County Health Department, stepping up as a healthcare provider. I'm part of, even though I'm providing all the care from my home, I am part of the group that has somehow been put to the front of the line. The idea being they want all healthcare providers vaccinated. What's happening is healthcare providers are becoming infected with COVID, and then they are not able to return to work. And that's leaving a lot of patients without care or having to scramble to find a new provider in the middle of a pandemic. So that has become an issue. I haven't heard the media talk about that, but that has become an issue. That is why healthcare providers have been pushed to the front of the line. So I had the opportunity to interact with my own county health department through telephone calls, taking a survey online to get my name on the list, and also reviewing their website. So let me sum it up in one sentence. It is completely chaotic. There's no getting around it. I have interacted with social service agencies, the government, the county, the state, all kinds of programs over the last 30 years. And sometimes it can get chaotic interacting with social service agencies. And this is about as chaotic as it gets. So that's where seniors might need help also navigating the chaos. To provide an example, when I first went to my county health department, I found anything I'd ever wanted to know about COVID-19 except for why I was there on the website, which is how do I sign up to get a vaccination? I was able to call and they said, fill out the survey and that's how you sign up. And I said, I already filled out the survey. So they said, we'll get back to you in 2 to 4 weeks. So then 2 days later, it was a quick 2 to 4 weeks. I had somebody call me just to verify email and to verify I was indeed a healthcare provider. And that person said, by the end of the day, I will get back to you with an email. You'll be able to schedule a vaccination in 1 to 2 weeks. And that was last week. I still haven't received that. So we're going to be hearing, the good news is my name is on a list somewhere, and I don't know where it is, and it might be going up and down off of the list. I mean, I don't know. But my name is on a list. And I think that is where seniors are going to need the most support. Most people are not accustomed to interacting in chaos, chaotic systems. Because I work in healthcare, I bill insurance companies, I am accustomed to interacting with chaotic systems. And I know my name is on a list and I know eventually I will be called. This concludes episode 4 of The Dish on Aging. I look forward to talking with you all next week, where I will be explaining to everyone how to find a psychologist. Thank you very much. Have a great week.